All right, so in this video, we're looking at observational research, but with a more medical focus. And that's because this type of observational research is very similar to experimentation, as opposed to the observational research we talked about in previous videos related more towards marketing research or ethnography, where we look at culture as part of anthropology, or in sociology. Here we're looking at more medical, dental type of treatments. But with an observational study, the difference between it and an experimental design is that we don't get to really choose who is the treatment group and who's the control. So when we look at observational studies and more of that medical approach, yes, it's just like the other observational research in that we are observing behaviors and actions, and that we are observing people in their natural setting. The difference is in an observational study and more the medical approach, we are trying to see, well, it's similar to experimental design, right? In terms we want to look at one group that we would call the treatment and the control, but we can't assign them to those groups. So for example, this observational study conducted by the American Medical Association finds that children exposed to lead are more likely to suffer tooth decay. Okay, it's not an experimental design because we didn't take a group of children and expose them to lead and have another group that are not exposed to lead. Instead, what they did is they found 24,901 children ages 2 and older and did an assessment of those children and looked at the level of lead. Okay, so we placed them into two groups. We have one group that already has a low level of lead and the other that has a high level of lead. So we didn't choose which child goes into which. This is what is called a case control study. Okay, then they were monitored, and often these are longitudinal studies. We'll study over time to see with multiple dental checkups, how are their teeth doing? So the challenge with one of these types of studies is that confounding that we talked about in the previous video, because there may be something else that causes children to be in one of those categories. So for example, the concern is that if they are, let's say they're in a low income area, they're going to be older houses. They're going to be more likely to have high levels of lead in the pipes and infrastructure. And that also means, though, they may not have a healthy diet. So how do you know if the dental problems are due to the lead or due to the less than healthy diet due to that lower income level? So if we're doing an observational study in this type of case, what we want to do is we want to, as much as possible, control for the income level, control for the portion of diet due to carbohydrates. So we would ask them a bunch of questions when we were deciding who gets to go into what category, and then try to build our two samples so that there are individuals who have low levels of lead but have lower income, and those with low levels of lead who have higher income. And low levels of lead have lower income, and high levels of lead have low income. And then we have those who have high levels of income, low lead, and high levels of income, high lead. So the difference between is the lead, not the income, not the diet. So when you put them into those different groups for monitoring, you really just want it to be the lead that's the difference. But because this is an observational study and non-experimental design, we can't choose who gets the high lead and low lead. They're already being impacted by that, and we're following them over time. So in this particular example, first question, what's the explanatory variable? So we're thinking the explanatory variable is the lead. The response is going to be tooth decay, right? The number of teeth that have issues. And then the confounding variables would be things like income, proportion of diet. We would attempt to control for as much as possible. All right, so we said this was a case control study. A case control study, the cases that have a particular attribute or condition are compared to the control so that we can see the impact of, in this case, the lead, that explanatory variable. Okay, and the issue here is that in a observational research versus a experimental design is that because we can't choose who gets impacted by the lead, we don't have true randomization. Okay, so we try to match as much as possible. We call these matched pairs. A matched pair is that high income in both the lead and low, high lead and low lead, and the it's too many words for me to keep track of all at once. Low income in both the high lead and low lead, high income in both the low lead and high lead, so that they are similar in every way as much as possible, except for the lead issue, is what we're trying to accomplish. Okay. So examples of case control studies, we would try to match based on medical history. We would look at history of exposure to a suspected risk or protective factor. We look at groups of people. So we would want to look at people, like we like to do observational research with twins, right? Because they grew up in the same environment. If we can find a twin who has some kind of event, characteristic, disease, something happening to them, we compare them to their twin and see in terms of that phenomenon if there's just one difference between them, because it allows us to control for everything else from the family, the environment. They likely have the same diet, same kind of physical activity. So that's one way to do this. We're trying to match them as much as possible. Example of case control studies during 1969 and 1970, there were 8 cases of adenocarcinoma that were seen in adolescent girls and young women in Boston. Up until that time, the disease was thought to be extremely rare. It was clear that these women must have been exposed to some kind of cancer-causing agent. So each of the 8 cases were matched with otherwise similar but healthy individuals of the same age. So again, trying to match their exposure to other medications, to products that they might use. And so looking at a person who had a similar diet, similar activities, to see if there would be a difference. Other examples of case control studies are ones looking at tobacco use and lung cancer, looking at risks related to breast cancer, identifying wells in London that contained cholera. So again, we don't get to choose which ones have the cancer or which wells have the cholera, but we try to find a similar comparator in order to look at that explanatory variable's impact on the response. Advantages of a case control study is that you can obtain your data relatively cheaply and quickly, right? Because people already have the condition that you're looking at. It usually doesn't have tons of cases. As if you can do a match and find very similar characteristics in individuals and control for most of those confounding variables, then you don't have to have as large of a data set. And you can use existing data records, so we can then find individuals based on all the data that's already available to match them. So we want to match based on as many variables as possible, things like health, so severity of illness, exercise, activity, obesity, environmental factors, income level, demographics. If you can eliminate a lot of the confounding variables, then your observational research in terms of case control can be as effective as an experimental design. And it can be used in cases where you would never want to give someone that particular, right? We don't want to give someone lead and see what happens. And so it's a way to measure those where we would not want to inflict on anyone the particular ailment that we think is the explanatory for some response. So we can use it to study rare diseases, diseases that have long latency, diseases where the exposure may have occurred years before, right? So you don't have to track somebody for 50 years if you find people who already have that particular illness in terms of measuring that effect. Downsides to case control studies: the differences between your case, your group, your treatment group, and your control. We have that issue of the confounding variables, right? Confounding variables can be the issue, and so you may not be able to find the association between your explanatory and your response, and whether or not it's some other variable that you haven't controlled for that's causing it. So be careful about your confounding. Be careful about what is considered the control group. Be aware of potential biases that are introduced when you are selecting who is going to be that control group. How much similarity do they really have with the group that you are looking at has that explanatory variable? When you are doing a case control study, it can be retrospective or prospective. And so retrospective looking back, prospective looking forward. So a retrospective study looks backwards in time, and the observational study for which the relevant data is from the past. So we could look at, for example, what's the leading cause of death for adults 18 to 24. Often in these cases, we are sifting through historical records. So these retrospective case studies are also actually secondary data analysis, because you're likely looking at data that you didn't collect and were collected for other purposes. So you can see that this observational research here is a little bit observation, is a little bit experimental design, is a little bit secondary data analysis as we start to kind of blur the lines for the methods we've discussed previously. We can look at, is the prevalence of violence among those with schizophrenia caused by substance abuse? So here we're often looking through medical records to look at both medical diagnosis as well as family history, and all this would be data that would be collected from, say, from medical research projects. An example of the schizophrenia one, there's a number of studies that have reported increased violence in patients with schizophrenia. So data on 404 schizophrenia patients was collected in Prague. Here, they collect the data that has the historical medical records, but also each schizophrenic was screened for violent tendencies when they were treated. So we have that data as well. So that's the modified overt aggression scale, MOS, was combined then with their medical records, with their family history, in order to do that analysis. And the researchers found that substance abuse was not the leading cause of violence. Violence behavior existed among the control group as well, that did not abuse drugs or alcohol. In comparison to a retrospective study, we have a prospective study. A prospective study looks forward in time, so we follow the participants and record events. So, for example, determining if children of alcoholics are more sensitive to the intoxicating effects of drinking alcohol. Does exposure to rap music increase the probability of risky behavior? And so here, these individuals are being followed over time. It's not experimental design because people are choosing the behaviors and the activities, and we're simply observing and recording for our group that is exposed to rap music, so by choice, and those who don't want to expose themselves to rap music, as it stated there, to look at the difference between them. Let's see what we got here. Okay, so retrospective studies are fast. Prospective studies are going to be slow because we're going to follow people over time. When we study a disease that takes a long time to appear, then typically we're using a retrospective study. Retrospective studies provide limited amounts of information. So there's problems with recall. We're limited to information that was recorded at the time. Memory, right? There's bias in terms of remembering things and what gets actually noted down. As we talked about observational research previous, with our more marketing research approach, we talked about, the challenge of the observer, especially if it's more open-ended in terms of the observation, is what was actually written down. And is that same information being recorded each time? Do they remember to look for it, to observe it, to write it down for each different individual and for each different event? So in our next video, we're going to compare observational study and randomized experiments as we start to get into randomized experimental design.